Welcome back, everyone. This month we've been talking all things cancer, and today it is mistletoe. I know what you're thinking. Why am I talking now about Christmas decor? Don't I have a fake mistletoe plant shoved in with my Christmas decorations somewhere? I'm sure that you do. You've likely thought about stealing a kiss underneath it. Why? I don't know. But using it to treat cancer probably never crossed your mind. This month we've been talking all things unconventional about everyone's least favorite topic, cancer. Vaccines are probably right up there with respect to cringeworthiness, but I'll save that nightmare of a conversation for another time. Unless you've been living under a rock, most people are familiar with standard cancer care: cut, poison, radiate. In the 3 previous posts, I explained why I believe that approach so often fails. The focus on fear, the failure to eradicate cancer stem cells, the lack of spiritual support, and the massive collateral damage to healthy cells. We have a ton of tools available to us outside of that framework. Some you've no doubt heard about, others probably not so much. Mistletoe likely falls into the latter category, so I would like to dedicate a bit more time to that topic. So let's get into it. To briefly recap on the current state of affairs, cancer doesn't seem to be going anywhere anytime in the foreseeable future. Quite the contrary. Malignancy rates have been on a steady increase for decades, with a frightening exponential spike upwards in the past few years. Despite novel therapeutics, cancer death rates are the same today as they were in the 90s. Drug development has no doubt shifted towards immunotherapy and away from more traditional chemotherapy as its cornerstone treatment, which is where botanical medicine started thousands of years ago. Funny how things come full circle. Viscum album, or European mistletoe, was the OG of immunotherapy. The Druids and Celtic naturopaths were the first in recorded history to use mistletoe in medicine to treat cancer, arthritis, ailments of the heart, epilepsy, and fertility as far back as 50 BC. How's that for historical use? In modern times, the use of mistletoe in oncology was pioneered in the early 20th century by Dr. Ida Wegman, a Dutch physician who developed the first injectable mistletoe extract for cancer patients. The down low on mistletoe. I am no botanist, but I know enough to tell you that all mistletoe is not created equal. Think roses. There's the climbing variety, the shrubby ones, the kind you need to toil endlessly over, and the type you couldn't kill if you wanted to. Unless you're me, of course, and then no plant is safe. Anyway, mistletoe varieties are similarly different from one another. Mistletoe is a hemiparasitic or semi-parasitic plant, depending on who you ask, that grows on various host trees, including apple, oak, maple, elm, pine, and birch. Parasitic plants are kind of like your kids and your money. For whatever reason, they don't have any, so they need yours to survive. Okay, that's not a fair analogy. Mistletoe needs a host tree, but it doesn't kill its host. It preserves it. Cancer, a true parasite, and mistletoe appear to be complete opposites in this regard. Native to Europe and Western Asia, European mistletoe, referred to as Viscum album, has a long history of medicinal use dating back to ancient civilizations. Early folks long recognized the plant's medicinal properties and healing powers. From here on out, I'll be referring exclusively to European mistletoe, again, Viscum album, and not the American mistletoe, which is the kind you hang over your door at Christmas. Aside from one having white berries and the other having red, the key differences lie in the basic constitution of the two types of mistletoe, particularly in their content of bioactive compounds. Things with names like lectins and viscotoxins, which are the key proteins that shake up the immune system and make European mistletoe an exciting tool in the war on cancer. Sugar, spice, and everything nice. Lectins, viscotoxins, and yada, yada, yada. Okay, so plants contain important stuff. It's why your mother made you eat spinach as a child. They have proteins, polyphenols, flavonoids, lots of big words behind their flowers, stems, and leaves. Mistletoe is no different. Some of these compounds are capable of modulating the immune system. Different plants contain different things, but all plants have these in one form or another. Analogy. Nightshades. Nightshade vegetables are notorious for their high content of a protein called lectins, which is great at irritating the human immune system. Tomatoes, bell peppers, potatoes, eggplants, they all look so beautiful in my summer garden photos, but lurking behind their skins are powerful proteins that really piss off our immune system. These proteins are called lectins. Lectins are plants' defense mechanisms. They are the equivalent of your immune system's killer cells. Look, plants need to defend themselves too. They weren't just put here on the planet to be pretty and food for animals. They never would have survived this long. When animals eat foods that are high in lectin content, they get sick. Imagine it's early in summer. The nightshade plants are just starting to set fruit. A bear walks by. He's hungry. The tomatoes are green, but come on, they're tomatoes. If festival foods can ripen them in the back with red spray paint, how underripe can they be? So our bear eats a bushel full of green tomatoes. Half an hour later, he's regretting this decision. After 60 minutes in a bath in the river, he's telling his friends, "Hey, I seriously just crapped my brains out back there by that brambleberry bush. I'm telling you, go easy on the green tomatoes." And the rest of his bear buddies, knowingly, respect the tomatoes. But then August rolls around. The tomatoes are feeling seductive. They lower their lectin content while they turn up the volume on sugar. Oh my gosh. The tomatoes smell so good. The bears forget about the early summer warnings and they try the fruit again. And nothing. No embarrassing accidents, no joint pain. Okay, maybe a little bit of the porridge being too hot situation, but they are miles away from that tomato plant before anyone has a code brown incident. The remaining high lectin containing tomato seeds run from the top of the bear's digestive tract down to the bottom and then into the soil, and the cycle of life continues. Mistletoe, a different kind of immune system kick. Like the nightshades, mistletoe also contains immune modulating compounds. They're different from those found in tomatoes, but the human body very much recognizes. What do we have here? These constituents heighten immune system activity, increase the quantity of specific immune cells, and directly inhibit the growth of cancerous tumors. What's that these compounds vary based on which kind of tree our mistletoe happened to be growing on, as well as what time of year the plant was harvested. It's pretty cool stuff, actually. There are many different compounds in mistletoe extract, but the two that do the bulk of the heavy lifting when it comes to giving your immune system superpowers are called lectins and viscotoxins. Collectively, they work as natural immunotherapy by bolstering your innate immune system function and directing an all-out assault on cancer cells. The three primary mistletoe lectins were creatively named lectins 1, 2, and 3. I might have chosen something more exciting like Dark Horse, Dragon Slayer, and Don Jr., but no one asked me. At incredibly low doses, these lectins upregulate apoptosis of cancer cells and confer direct cancer-killing properties. The mistletoe viscotoxins are regarded as plants' defensins. These compounds help protect the plant against bad guys like bacteria and fungi. In similar fashion, viscotoxins help protect the immune system against invaders like cancerous tumors. What's interesting about mistletoe extract is how selective it is for cancer cells. This isn't a carpet bomb approach. It's smart and tactful. Healthy cells are safe. Cancer cells are not. The power of mistletoe lies in the complementary nature of all of its compounds. There is no one mechanism of action here. The whole plant works together synergistically to produce its apoptotic and immunomodulatory effects. That term, immunomodulatory, is important here. Unlike many of our conventional immunotherapies, mistletoe extracts don't overly stimulate the immune system, they don't overly suppress it. They pull it back to center, positioning it to be perfectly on target to battle cancer. Additionally, mistletoe therapy just helps people feel better. It can help improve quality of life by reducing side effects of conventional treatments such as fatigue, nausea, and loss of appetite. Mistletoe can enhance overall well-being and energy levels, provide pain relief and reduce the need for painkillers, and extend survival rates in some cancer patients. Extracts commonly used in cancer therapy. I don't know that we need to get into the weeds on this, but some companies use aqueous extracts, some ferment them. Some companies only source from a few different host trees, others run the whole gamut. Some extracts are really high in lectin and viscotoxin content, others have far less. Regardless of their similarities and differences, the three biggest and most established companies are Iscador, Helixor, and Abnoba Viscum. Helixor mistletoe is the most easily accessible brand here in the US, and as such, the one I am most familiar with. Mistletoe extract is named by its brand and then by its host tree. Here's some Latin 101 for all of you scholars out there. Abetus, fir; fraxini, ash; molly, apple; peony, pine; quercus, oak. So if your Helixor brand mistletoe extract came from a fir tree, it would be called Helixor A. Who gets which extract from what tree made by which company is a complicated art form. When initially studying this, I went searching for my long-lost magic 8 ball from residency, but then learned that pairing patient to potion was a bit trickier than just testing for wind direction. Many factors play a role in selecting the best host tree and formulation for each individual person, including gender, general constitution, body type, lectin content, and type of cancer being targeted. Short story, leave the extract selection process to a physician trained in such things. Mistletoe administration. When used in the setting of cancer, mistletoe extract is given by way of a needle. It's most commonly given via subcutaneous injection, but in some cases it is used intravenously. Sometimes it's actually also injected directly into the tumor. I know you all hate needles, but I believe you hate cancer more. You definitely hate cancer more than a teeny tiny needle, don't you? Time for your brave face. I have every confidence you can do this. Unless you're my husband, and then you will refuse and make me do it for you. But everyone else, I have full confidence in. I love you, babe. The dose is started low and gradually increased until the target dose is determined. This is the dose that causes a mild but observable injection site reaction. The reaction doesn't happen right away. It typically happens 12 to 24 hours after the injection and looks like a slightly raised pink circle in the area of injection, about the size of a quarter. I tell patients we're looking for something about 1 to 2 inches across at the largest diameter. That reaction means we've struck gold. The immune system is turned on, charged up, and in cancer kill mode. Money. Sometimes that dose is really small, sometimes that dose is really big. It doesn't matter. Everyone is different. We just need to get to that dose and continue with every other or every third day injections. There are reasons to try to push that dose or change the schedule, but in general, this is the program. The first injection is typically taught in the office. The rest are done in the comfort of your own home. The overwhelming majority of people will have an injection site reaction, but some people don't. In a small subset of patients, it's a slight increase in body temperature that signals the target dose. Not a fever per se, but an increase in body temperature of about 1 degree Fahrenheit between morning and afternoon above what is typical for that person. Basic labs like CBC, CMP, sed rate, CRP, and LDH are often done on a monthly basis to keep an eye on things. These are inexpensive measures to make sure your immune system is in the driver's seat here and not the cancer. To recap, mistletoe therapy is typically administered subcutaneously, which means under the skin, or in an IV, and rarely into the tumor. Common reactions include local inflammation, swelling, redness, tenderness, and itching. These reactions are indicative of the body's immune response. The therapy can be cycled with periods of administration followed by breaks, tailored to the patient's condition and response to treatment. The art and science of warmth. This mistletoe situation is largely supported by the Physicians Association for Anthroposophic Medicine, which is the European equivalent of functional medicine physicians here in the US, at least in terms of philosophy. Loosely, treating the patient as a whole, supporting mind, body, and spirit, and discovering and managing root causes. Anthroposophic docs might be considered a bit more woo-woo than even us functional folks. They're much more connected to source and energy and use these concepts in their practices with skill. I'm going to do a PubMed search to determine which host tree to select for a patient. They're going to use the force. Got me? Mistletoe is considered a warming therapy. And not just because of its ability to raise body temperature, although it can certainly do that. A common misconception is that fever is something that needs to be treated. Physiologically, the body intentionally warms up in the setting of an infection. as a means to kill invading pathogens. Interestingly, if we look at a person's warmth as their body temperature, we can observe a slow but consistent decline over time. A research study titled Decreasing Human Body Temperature in the U.S. Since the Industrial Revolution gathered data from 1860 to 1940, 1971 to 1975, and 2007 to 2017. They reported a 0.05 degree decrease in the body temperature of both men and women every 10 years since 1860. Today's average body temperature is 97.9, not 98.6, which was long considered to be normal, probably because of global warming. Not only do our temperatures seem to change from one generation to the next, they fluctuate from sunrise to sunset as well. We're about 1 degree warmer in the afternoon than we are when we first wake up. This observed natural variation in body temperatures is often incorporated into mistletoe therapy. Mistletoe bringing warmth and something else to encourage cool. Helleborus niger. One such adjuvant is the Christmas rose, or Helleborus niger. Lots of holiday themes here, I know. Another crazy plant that flowers in winter when everything else is dead. If mistletoe is the yin of the story, Helleborus is the yang. Both plants bloom in the winter, but that's pretty much where their similarities end. One brings the tide, the other sees it fall. The two therapies are intertwined in a rhythmic, ebb and flow-like dance with one another, constantly keeping the immune system on its toes. Helleborus is often used alongside mistletoe therapy on alternating days, or even at different times of the same day. It is used most frequently in cases of lymphoma, leukemia, myeloma, sarcoma, prostate cancer, and metastatic complications. High-dose intravenous vitamin C is also considered a cooling therapy and is often utilized alongside mistletoe and Helleborus. Mistletoe fever induction therapy. Fever is an interesting phenomenon. If you remember the last time you had one, you likely recall how miserable you felt. Fever raises body temperature in an effort to kill toxins, but the temperature change simultaneously kicks the immune system into high gear. Although uncomfortable, fever is a major workout for your immune system. A study published in 2001 noted that patients who never experienced fevers were 2.5 times more likely to develop cancer at some point in their life compared to those who'd had fevers in the past. Several studies have observed spontaneous remission of cancer in patients following an acute febrile illness. Medical hyperthermia is the practice of intentional fever induction for the sole purpose of stimulating the cytotoxic and modulating effects of the immune system. Mistletoe fever induction therapy involves the use of mistletoe extract to deliberately cause a fever in cancer patients. It is far more intense than the effects seen with subcutaneous injection. Mistletoe is often administered via injection without febrile effects, but if dose is adjusted upwards, it certainly can cause one. Mistletoe fever induction therapy is typically high lectin intravenous mistletoe or high dose subcutaneous mistletoe given to stimulate a fever of 100.4 to 104 degrees Fahrenheit. Historically, this fever therapy is provided a couple of weeks before chemotherapy in an effort to enhance the effects of conventional therapy. As to not confuse the two, mistletoe fever induction therapy is similar to medical hyperthermia, but not as aggressive. Temperatures upwards of 106, sometimes up to 114 when using localized therapy, can be achieved with medical hyperthermia, but are done under strict medical supervision or hospitalization with liberal use of binders and alkalizing agents to assist the body with detox and maintain a normal pH. Both therapies aim to wake up the immune system and to make it more active against cancer cells. Dramatic responses to mistletoe therapy. There are potentially two rather dramatic responses reported with mistletoe therapy: tumor lysis and pseudotumor progression. I mention these because both indicate a positive response to therapy, but both can be kind of frightening on the front end. Tumor lysis refers to the rapid breakdown of cancer cells. When cancer cells are destroyed quickly, their contents are released into the bloodstream. This can cause a surge of cellular debris and metabolic byproducts that the body must process. While this indicates the therapy is working, we don't want too much too fast. If signs of tumor lysis occur, mistletoe therapy is paused until symptoms subside and is restarted at a lower dose. Pseudotumor progression is a temporary increase in the size of a tumor observed on imaging scans despite the therapy being effective. It's not actual tumor growth, but rather a response to treatment. As the immune system attacks the tumor, inflammation and fluid buildup can cause the tumor to appear larger temporarily. Over time, the inflammation subsides and the true reduction in tumor size becomes apparent. For this reason, imaging is typically avoided in the first 6 to 8 weeks of mistletoe therapy. Contraindications: latex, bananas, avocados, kiwi, and chestnuts have lectin content with similar composition to that found in mistletoe extract. True cross-reactivity allergic reactions are extremely rare, but skin testing is recommended before starting injections in patients with allergies to these things. Pregnancy, first trimester. Nothing is intentionally studied in pregnancy because these studies just aren't ethical to do. Hey, pregnant lady, want to be in our safety study to test out this brand new therapy no one's ever tried before on your unborn child? Yeah, no. The mistletoe folks report safety in the latter stages of pregnancy, but a real discussion should be had on risk-benefit analysis before starting. Brain lesions. Brain lesions can be seen as both primary and metastatic tumors. Your brain is inside your skull, which is hard as a brick. Not much room for wiggle. Any therapy aimed at treating brain lesions is tricky because of the potential for tumor lysis and/or pseudoprogression. Swelling inside the skull increases the risk for all sorts of bad things to happen. Conventional management utilizes high doses of corticosteroids to keep inflammation under control. Because of its potential to cause pseudotumor progression, mistletoe is typically contraindicated in brain lesions, but has been safely conducted in closely controlled settings with low lectin content extracts. Conclusion: while mistletoe therapy is widely accepted and used in Europe, it remains less mainstream in other parts of the world, including the US. Ongoing research continues to investigate its efficacy and potential integration into broader oncological practice, but plants can't be patented, so there's that. Studies reporting its utility in treating hypertension, Alzheimer's disease, mood disorders, wound healing, liver and kidney dysfunction, epilepsy, and overall anti-aging properties continue to mount, suggesting this plant can do far more than just cancer. Mistletoe has a centuries-long history of medicinal use and is now gaining recognition, if not by the conventional care system, certainly by those with eyes to read. The data speaks for itself. Extracts such as Iscador, Helixor, and Abnoba viscum are valued for their ability to support conventional cancer treatments and improve patients' quality of life, making mistletoe therapy a significant area of interest for those of us wanting to make inroads for the millions of people suffering with cancer. The U.S. Food and Drug Administration has not approved mistletoe extracts as a treatment for cancer or any other medical condition. Thanks for listening.